Hey, Dr. Charlie, how do I get rid of the tightness in my buttock, in my piriformis? It feels so tight. I've tried everything to resolve it, but it's just not working. This is a very common question I get. So in this video, I want to share with you 3 of the best ways that I found to help people like you loosen the sensation of tightness, get rid of it, right, that you might be experiencing in your glute and or in your piriformis, your butt region. And this video will be especially helpful for you if you've tried the usual sort of traditional cookie cutter ways of solving it, such as, foam rolling, self-massage, using a massage gun, things like that, maybe getting deep tissue even, and or doing figure 4 stretches and nerve glides and stuff like that to try to loosen up what you experience as tightness in your butt. And you found that either A, it doesn't work, the tightness is still there, and or B, later on, right, it might hurt so good in the moment, but later on things are actually worse. It actually flares things up and makes the tightness more pronounced in your buttock, which is the exact opposite of what you were trying to do. And before we dive into some ways you can loosen your piriformis muscle, be sure to check out my Better Than an MRI DIY diagnostic guide so you can figure out the source of your symptoms. So inside the guide, I lay out the exact step-by-step framework, right, to help you figure out the most likely cause of your symptoms without needing images and or to see specialists. And you can download that guide for free up here. Just click and tell me where to send it. All right, so let's dive into the 3 best ways that I found to help loosen tightness in the piriformis area. So first things first, give it some slack. Meaning instead of trying to lengthen your piriformis, try shortening it, right? And so let's define lengthening as pulling 2 points, point A and point B, further apart. So this would be lengthening, right? So taking point A and point B and pulling it further apart. You would call that stretching. I just call it lengthening. Now let's define shortening, or the opposite of lengthening, right, as bringing these 2 points closer together. That being said, the logic is simple. So if lengthening or pulling these 2 points further apart in your buttock or your piriformis area, stretching your buttock or piriformis muscle has not worked, doing the opposite approach usually yields the exact opposite result. So if lengthening equals not working, then is it possible that shortening equals working? So be sure to hang around to the end of the video. I will share another video that I created in the past that really lays out clearly exactly what I mean by shortening your piriformis. The second way that you can loosen and or reduce the tightness in your buttock area is to stop poking the angry bear. So physically, you want to stop poking the angry bear by digging your fist into it, by massaging it, by sitting on a tennis ball, foam rolling, or massaging the area, right? And psychologically, by always checking in on it, right, to see if it's still there, right? And many people do this subconsciously. So you're not doing this probably on purpose, but subconsciously, when you're in pain, you tend to go insane. Not your fault. You just have a human brain, and sometimes human brains get a little clouded as far as their judgment. And right, so, if this chatter is happening, hey, I wonder if it's still there. Is it better now? Is it better this morning than it was earlier? Is it better today than it was yesterday, right? You constantly and incessantly are checking on this thing. Anxiety starts to build, right? You tune into your pain more frequently, hoping that it'll go away. And the more that you focus on it, the more it will expand. And so your pain and or your tightness will not go away if you keep fueling it with attention. And the third best way that I found to help folks reduce tightness in their buttock and or their leg, if you have some type of piriformis syndrome and sciatica, for example, is to pump it up. And what I mean by this is just take any activity that feels safe, right, and just gets you moving, gets the endorphins going, and just gets your body in a state of flow, and do it frequently. So if you can walk, walk. If you can bike, bike. If you can squat, squat. It doesn't matter. Let's just say everything in your lower body is off limits. Dr. Charlie, I can't do anything, nothing can help me. Well, your arms still work, so why not do some push-ups or pull-ups or anything you can do, right, to get the system going and keep your body in shape. So resting your pain away won't work. You want to stay as active as possible and keep your body moving. And now the final key element to really make this whole idea of pumping it up or staying active and moving your body work is to think of movement as medicine. Again, if you can walk, walk. If you can bike, great. If you can squat, if you can push-ups, whatever it is, right? You want to take that activity and bottle it up. Bottle it up, put it inside of a pill bottle, right? And instead of, popping a pill, like a muscle relaxant or an Advil or something like that, take that movement that makes you feel good, makes you feel safe, right? And kind of get you moving in the right direction. And on any given pill bottle, on any given, prescription, you have 3 elements. You have a dose, how much, you have the frequency, how often, and then you have the timing of when you take it. In the morning, in the night, right, etc., right? So you want to take whatever it is that you can do, walking, biking, squatting, push-ups, rowing, whatever it is. It's got to be specific to you, and you've got to do it, right, because you want to do it. So it's got to be fun, because if it's fun, it'll get done. But what you want to do is you want to put it in that pill bottle, and you want to say, okay, how much of this do I feel like I could tolerate safely? And that gives you the dose. Maybe it's 10 minutes, maybe it's 5 minutes, maybe it's a certain distance, but start with something that feels safe. And then you want to ask yourself, okay, how frequently should I be doing this? So if you love walking, rather than going for just one long walk in the morning, why not split it up? And instead of doing one half-an-hour walk, why not do 3 10-minute walks? So increase the frequencies. You can take that pill more often. And finally, timing. Think about when you take movement as your medicine. If you had a headache at 2 p.m., right, you wouldn't take your medicine at 5 a.m. You would take that headache pill, say, at 1:45, or right around the time that headache started. So if your symptoms are worse in the evening, yes, you can walk for 10 minutes or 30 minutes, and you can do it a couple times a day, and that's a great start. But think about when you want to do it. You don't want to do that walk maybe as so much in the morning. You want to kind of time that walk such that it's around the time when you're going to have most symptoms. And ideally, you do it before, right? So if symptoms come on, say, at 4 o'clock, you've had a long day, you've been sitting a lot at work, or whatever it is, right? Time your walk. Go for a walk at 3:45 for 10 or 15 minutes, right? So you want to think about movement as medicine. All you need to do now, once you have something that's safe and gets you moving in the right direction, is you want to optimize the dose, the frequency, and the timing. The art of solving these problems is in finding the specific motions for your specific pain problem, right, to get you out of trouble. And obviously there's a process to do that. This is beyond the scope of the video, but start by finding something that feels safe, optimize the dose, the frequency, and timing, and that is how you use movement as medicine. And the third and sort of final recommendation for helping people release the tightness or reduce the tightness in their buttock, again, is to pump it up and find a movement that they can bottle up and use as medicine moving forward. So that's all I got for this video. Again, just to summarize, the 3 ways that you can best loosen and or reduce the tightness in your buttock or piriformis region is, number 1, you want to give it some slack. So instead of lengthening, try the opposite. Lengthening ain't working. What's the opposite of lengthening? Shortening. What's the opposite of not working? Working, okay? So again, here in a moment, I will link on the end screen to another video that I previously recorded that should help you out. The second thing is you want to give it a break, right? Physically and or mentally poking the angry bear by thinking about it all the time and or checking in on it with your thumb or with a ball or whatever, right? Not the best idea. It's just gonna fuel and perpetuate the tightness. And the third way you can loosen or reduce tightness is to pump it up. Find a motion that feels safe, right? Bottle it up, and then optimize, right, the dose, the frequency, and the timing, and take it as you would any other medication. So that's that. So if you found this video useful, please hit the like button. Also, subscribe for other videos that I post weekly. Hit the bell for notifications so you get notified when I post those videos. And also, be sure to comment below and let me know if this was useful and if there's other things that you would like to learn. So that's all I got. Until next time, everyone, thanks for checking out my channel, and we will chat soon.